Okay, hi, I'm Brittany. I'm going to be the FNP student doing your head, ears, eyes, nose, and throat exam. If you have any questions, let me know. Wash my hands. You ready to go?
Yes.
Okay, so first I'm going to inspect your head. So I'm looking for any asymmetry, any signs of trauma. From what I see, I don't see any asymmetry. It looks equal, it looks round. No signs of trauma, no signs of any balding that I see. And the hair distribution looks healthy and normal. Now I'm going to palpate your head, if that's okay. Okay. Also, as I'm looking at your head, I see your skin is healthy looking. It's not cyanotic. It's pink. No signs of any lesions on your face. No signs of lesions on your head. No depressions. No tenderness.
No.
No signs of lice, no signs of dandruff. Dandruff looks good. The head is also not oily, not too dry. Now I'm going to palpate your temporal arteries. So I'm going to palpate them for tenderness, any pain or anything.
No.
Good, no cord-like feeling. The artery is about a 2+, and I don't feel any thrill. Then I'm going to come down to your lymph nodes. All of them I'm going to check to make sure they're shoddy, small, movable, not tender. So I'll start with the preauricular, postauricular, tonsillar, submandibular, submental, anterior cervical, posterior cervical, occipital, and then subclavicular, and they all are small, movable, non-tender. Then I'm going to come over and I'm going to test your cranial nerve number 5, which is the trigeminal nerve. So I'm going to have you clench your jaw and try to open it. Good, intact. And then I'm going to take this and just make sure that everything feels equal. There's no any pain when I do this. Equal. No pain.
Nope.
Pain. No pain. No. Good. So the cranial nerve number 5 is intact, and then we're going to do cranial nerve number 7. It's a facial nerve. We're going to make sure that when you do these movements, I don't see any asymmetry in the movements to make me think there's any stroke or Bell's palsy. So I'm going to have you smile, frown, puff your cheeks, hug your lips, raise your eyebrows. Perfect. Looks good. Symmetrical. Then I'm going to go to your ears. So I'm going to look at them for position and shape. They look proportional, they look equal. And then I'm going to inspect your mastoid bone behind your ear. There's no redness, there's no swelling. I'm going to percuss it for any inflammation, any tenderness.
No.
And I'm going to palpate it. Any tenderness there?
No.
Perfect. I'm going to do the same thing on this ear, so I'm inspecting the mastoid. It's not red, it's not tender. And then I'm going to percuss it. Any tenderness? No. Then I'm going to palpate it. No tenderness. No. Then I'm going to come over and I'm going to do the pinna, palpate that, and the tragus for any tenderness or masses, any tenderness or pain.
No.
Do the same thing on the left side, so I'm palpating the pinna and the tragus. Any tenderness?
No.
Perfect. And before I go into your, I'm going to do cranial nerve number 8, the vestibular cochlear. I'm going to do the whisper test, so I'm going to have my fingers over here like a piece of paper, and I'm going to whisper a number.
63.
Perfect. And then the same thing over here.
72.
Perfect. So the cranial nerve number 8 is intact. Then I'm going to do the Weber and Rinne test. So with the Weber test, I'm going to put this, after I do this, on the center of your ear, and you're going to tell me, does the sound lateralize to both sides? Okay, so that is a good sign that your conductive hearing is intact. There's no conductive or sensorineural impairments. And then I'm going to do this. I'm going to put it on your mastoid bone, and tell me if you hear it.
Yes.
So tell me when you don't hear it.
No.
And then, do you hear it here?
Yes.
So tell me which is stronger?
This one.
Okay, perfect. So air conduction is stronger than bone conduction, which is a good sign. We'll do the same thing on this side.
I'm not here.
And then over here, which one is stronger?
This one.
Okay, perfect. So air conduction is stronger than bone conduction. That's good. And then I'm going to look into your ears with the otoscope. So what I'm looking for is to make sure that the canal looks clear, there's no cerumen impaction, there's no redness, there's no discharge. It looks good, it looks healthy, there's not a buildup of wax. And then the tympanic membrane looks healthy. It is a pearly white-gray color, there's no perforation, there's no scarring. And the cone of light is at 7 o'clock. Perfect. And then I'm going to do the same thing on the right. So I'm looking for any cerumen impaction, any redness, swelling. Looks clear, looks good. And then the tympanic membrane, the cone of light is at 5 o'clock. And it is a pearly gray appearance and looks healthy, no perforation, no scarring. Awesome. So your ears look great. And then we're going to go to your eyes. So I'm looking at your eyebrows, your eyelashes, and your palpebral fissures. They look good, they look healthy. The hairline distribution is full, no signs of balding. And then I'm going to look at your sclera, so it's white, there's no signs of hemorrhage or jaundice, so no yellowing. And then we'll look at your conjunctiva, look up. It looks pink and moist, so no signs of conjunctivitis, no paleness to indicate anemia. Looks good. And then we're going to test your cranial nerve number 2. So first I would do the Snellen chart. I would hold it with this mini one. I'd hold it 6 feet away. I'd have you cover your left eye. Have you cover your left eye to see which line you could get, and then I'd cover your right eye to see what line you could get, and then do both eyes. And if you did wear glasses, you'd wear the glasses to do this, but you don't wear glasses, so you do it without them. And then also for the cranial nerve number 2, we're going to do the confrontation test. So I'm going to cover my right eye, you're going to cover your right eye, and we're going to have, tell me when you see
No.
and then
No.
perfect, and then my left eye and your left eye.
No.
Perfect.
No.
Perfect. And then we are going to do the cranial nerve number 3, the ocular motor. So I'm going to take this flashlight. I'm looking at your pupils right now. They're round. They're equal. They're about 3 millimeters. They're about, 2 or 3 millimeters. Now I'm going to see if they're reactive to light. So put the light over. They constrict. And as I'm doing that, as I'm doing it on your right eye, your left eye should constrict, which is a consensual reflex, and they both do. And then I'm going to take this and I'm going to bring it towards your nose. You're going to look at it. It's going to converge, and your eye pupils should constrict. Perfect. So that's the accommodation reflex. That's intact. And then we're going to go on to your
Pause.
And now we're gonna do the 6 cardinal gazes. So I'm gonna hold my finger like this. You're gonna hold your head still. So you're gonna go up, down, left, right, diagonal, 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 diagonal. So that's 3, 4, and 6 I've tested. So that's intact. Then we're gonna go to your nose, so it looks straight midline, no signs of fractures or any accidents, acute anything. And I'm going to look inside your nose with this to make sure that it looks clear. It looks for your redness or discharge. The turbinates look healthy, pink, moist, no polyps. The septum is intact, no holes in it. And as well on this side, same thing. It's pink, moist, no discharge. The turbinates are pink and moist. Septum is intact, looks healthy. And then we're gonna assess the olfactory nerve, cranial nerve number 1. And I'm gonna have you sniff this and tell me what it smells like. Coffee. Perfect. And then I'm gonna assess your nose for patency. So just cover one nostril, snip, clear, and then this one. Perfect, you can breathe out of both of them?
Yes.
Awesome. Now we're gonna move down to your mouth, and I'll have you open your mouth. Perfect, so your hard and soft palate, your buccal mucosa and tongue look healthy, pink, moist, no signs of candida, no signs of like any ulcers. I'll have you stick your tongue out and say ah. So that's cranial nerve number 9 and 10. So I see your soft palate and your uvula rise at the same time. I'm looking at your pharynx. It doesn't look red or inflamed. Your tonsils are not are too small to see as well, so that's a good sign that there's no infection. And then I'm going to have you stick your tongue out. Perfect. That's hypoglossal cranial nerve, and that is straight in midline, so that's a good sign. Now I'm going to test your mandible for TMJ. So open, close, nothing any crepitus, no subluxation, no tenderness. Perfect. And then we're going to move on to your neck. So your neck looks healthy, the skin looks dry, not cyanotic, pink. As I'm looking, your trachea does look midline, but I'm going to palpate it to make sure it is midline. There's no tenderness?
No.
Perfect. I'm going to palpate your trachea, thyroid. I don't feel any goiters or nodules. Can you swallow? Perfect. I'm also going to palpate your carotid artery. So, perfect. I don't feel any thrills. It's about a 2+. Same on this side. It's about a 2+, no thrills. I'm also going to auscultate it with my bell to make sure there's no bruise. Sounds normal, no signs of bruise. Same on the left side. And then I'm going to have you shrug your shoulders, and I'm going to try to push it down. Perfect. That is cranial nerve number 12. Testing that is intact. And that is all. Oh, also I do have to do the range of motion test. So last thing is the range of motion of your neck. So we're going to do flexion, extension, hyperextension, lateral flexion, and then around. Perfect. You have good range of motion. And I thank you for letting me do that head, ears, eyes, nose, and throat exam. Thank you.